Hi, I'm Dan Berhano, and I'm going to demonstrate how to put in a femoral line. So the first thing I'm going to do when I come to put in my femoral line is just to establish to everyone else that I'm going to be using sharps. So I'm going to say, hey, everybody, I'm going to be using sharps, so everyone be careful.
Thank you.
You're welcome. So the next thing that I'm going to do is that I'm going to find some of my landmarks, and being the AS-IS and the pubic symphysis or tubercle, and I'm going to use those landmarks to help guide me towards where I can find my femoral artery and vein. So I'm going to assess for both of them, and then I'm going to find my inguinal ligament, and I'm going to look just below it. So now I found them both. I'm going to feel for the femoral artery using my fingertips. And at this time, I've found where I think the femoral artery is. So at this point, I'm going to use sterile technique. I'm going to use betadine or chlorhexidine, and I'm going to sterilize the patient. I'm going to put on a gown myself. I'm going to drape the patient. Then I'm going to put lidocaine where I believe I'm going to be inserting my needle where I found my femoral vein. So I'm going to do that while I let my lidocaine sit. I'm going to go over to my kit and make sure that I have everything. The main things that I want to be using here is going to be my introducer and needle, my guide wire, which is right here, something to dispose my sharps, a dilator right here, a knife, and some extra tubing if I need it. So now I'm going to come back here. Also my triple lumen catheter, the most important part, which I'm going to flush all 3 ports, and then I'm going to close off the 2 ports which I do not need to use. So now at this time my patient should be anesthetized. I'm going to come back, again using my sterile technique. I'm going to find my landmarks where I left off last time. I'm going to find where I feel is the femoral artery. Get my syringe and needle. I'm going to have it so the bevel is facing more medially. So I found my artery, and now I'm going to go about 1 centimeter medially to that, and I'm going to point the bevel of my needle medially, and then I'm also going to insert at a 45-degree angle up towards the umbilicus. And as I press in, I'm going to draw back. And now, given this, I've got blue in here, I'm in the vein, but if we're not in the vein, another technique would be to use ultrasound. Since this is a dummy, I'm going to push back in the venous fluid. At this point, I'm going to make sure that my introducer needle stays in and not to move it while I come back and grab my guide wire. At this point, I'm going to use my guide wire, put it into my introducer, and I'm going to thread it in. Okay, and once I feel I have a sufficient amount of guide wire in there, I can pull it so the rest is out. At this point, since I have a guide wire in, I can now remove my introducer. So the whole point of this is I always want to keep one hand on the wire. So I'm going to brace myself on the patient, pull out my needle, again grab my needle back here, dispose of my sharps and somewhere to put my sharps. And then next thing, since I have my guide wire in, is going to be to get my knife before I put my introducer in. Okay. I guess I don't know how to use the knife. Got it. I'll make a mark or a score, not really a score, I'll make an upward cut on top of the guide wire just to make it so there's a little bit more room for my dilator. At this point, I'll feed my dilator over my guide wire. And at this point I'll go about 2 to 3 centimeters so I can get below the fascia and then introduce it in what should be the vein. After I put that in, I'll pull my dilator out. I will then go for my triple lumen catheter and introduce it in the same fashion. Given that I'm probably going to run out of wire, Next best thing to do is to pull back a little bit on my guide wire, because I always need to have one hand on it until I can get a sufficient amount to come out the top. And once I have my hand on the top of the guide wire, I can then insert my triple lumen catheter, which I would push in, but since it's the dummy, I will refrain. And then the last step is going to be to remove my guide wire, hand it to my assistant, and at this point I can advance it, or I should have already advanced it before I pull my guide wire out. Should be about 8 to 12 centimeters in there, and once I'm done with that, I can either put a tegaderm to secure it or I can suture it in place. And that is how you put in a femoral wire.